The PneumaGlide is a patented disposable airway device for assisting with intubation. By virtue of its design, the PneumaGlide inserts along the hard palate. Its distal end enters the esophagus, blocking the esophagus from incorrect placement of a breathing tube there. Incorrect placement of a breathing tube in the esophagus can cause a decrease in oxygen, which can rapidly be fatal. The PneumaGlide also protects the teeth. The dental guard portion rests along the upper incisors of the mouth, protecting them from torque. Complications during laryngoscopy and intubation occur more frequently in inexperienced hands, such as medical students, paramedics, residents, or people who do not perform the procedure frequently, but can also occur with experienced laryngoscopists during a difficult airway which is unexpected or anticipated. The PneumaGlide inserts blindly along the hard palate and enters the esophagus. The dental guard rests along the upper teeth. With the esophagus blocked, the tube is guided into the correct position, which is the trachea. The PneumaGlide is then easily removed and ventilation can proceed with the endotracheal tube in the proper place. I'm Dr. Melissa Frankowiak, and I designed the PneumaGlide with 15 years of experience as an anesthesiologist in order to prevent some of the most common complications that occur with intubation, including damage to the teeth, improper placement of the breathing tube in the esophagus, gastric insufflation of air while ventilating the patient, and one of the most deadly complications during intubation that can occur, gastric acid aspiration of stomach contents into the lungs. With this in mind, the PneumaGlide attempts to solve these problems by virtue of its design, and I hope you'll use the PneumaGlide in your patients to make it safer, easier, and more comfortable.